In this presentation, we will look at the masticator muscles. So we have already discussed there are four muscles of mastication: the temporalis, the masseter, medial pterygoid, and the lateral pterygoid. So the temporalis muscle takes its origin from the temporal fossa and the temporal fascia and inserts onto the coronoid process of the mandible and the ramus of the mandible. The masseter muscle takes its origin from the zygomatic arch and the maxillary process of the zygomatic bone, and it inserts onto the lateral surface of the ramus of the mandible. The medial pterygoid muscle takes its origin from the lateral pterygoid plate and also from the tuberosity of maxilla and inserts onto the medial surface of the mandible. So the masseter inserts onto the lateral surface of mandible and the medial pterygoid inserts onto the medial surface of mandible. One more thing to note here is that though the name is medial pterygoid, it can be a little misleading. Both the medial and the lateral pterygoid, they take their origin from the lateral pterygoid plate. The medial pterygoid takes its origin from the medial surface of the lateral pterygoid plate, and the lateral pterygoid takes its origin from the lateral surface of again the lateral pterygoid plate. The lateral pterygoid inserts onto the capsule of the temporomandibular joint and the neck of the mandible. Let's identify it on a CT scan now. I find it easy to identify these muscles of mastication when I start at the level of the mandible. So we are going to scroll from caudal to cranial. So this is the mandible here. So I'm going to scroll cranially. So as I scroll cranially, I'll see two muscles along the ramus of the mandible, one lateral to it and one medial to it. So here, so there's a muscle that is lateral to the mandible, and there's another muscle that is medial to the mandible. So the muscle that is lateral to the mandible and attached to the ramus is the masseter muscle, and the one that is medial is the medial pterygoid muscle. So I'm continuing to scroll cranially. So again, this muscle here is the masseter muscle, and this muscle medially is the medial pterygoid muscle. One more important thing that I would like to point out here is that residents usually confuse the masseter muscle for the parotid gland. So they usually contour the masseter as the parotid gland. So now that we have seen so much muscle anatomy, let's find out the muscles around this area. So just lateral to the ramus of the mandible and attached to it is the masseter muscle. So you don't confuse that with the superficial parotid. Deep to the ramus, medial to the ramus is the medial pterygoid. So again, you don't confuse that with the deep parotid. And here, this, as we saw in the previous presentation, that this is the posterior belly of digastric. So this structure that is squeezed between these, around these muscles, is the parotid gland. So I'm continuing to scroll cranially. So we are only focusing on the masseter and the medial pterygoid for now. So they are quite prominent, easy to identify. So now you will see that the medial pterygoid will attach to the lateral pterygoid plate, the medial surface of the lateral pterygoid plate. So this here, the medial pterygoid is taking its origin from the medial surface of the lateral pterygoid plate. So I'm continuing to scroll cranially. Just keep looking at the masseter. The masseter will now go and attach to the zygomatic arch. So to now see the temporalis and the lateral pterygoid, we will go all the way up and then scroll caudally. So we will now scroll caudally, and this muscle here that lies in the temporal fossa is the temporalis muscle. So it appears as a thin sheet over here. So I'll continue to scroll caudally. So you can now see this muscle here taking its origin from the lateral surface of the lateral pterygoid plate. So the lateral pterygoid basically extends from the lateral surface of lateral pterygoid plate to the temporomandibular joint. So this muscle is the lateral pterygoid muscle, and this here is the temporalis muscle. So I'll continue to scroll caudally. So the temporalis here inserts onto the coronoid process. So you can't see the lateral pterygoid now, and this here is the medial pterygoid muscle. So this muscle lateral to the ramus of the mandible is the masseter muscle, and the muscle medial to it is the medial pterygoid muscle. Posterior to both of them here is the parotid gland. So we will now see on another patient. So again, starting from caudal and going up cranially. So we can now see the mandible. So you can see two muscles attached to it, one medial to it, that is the medial pterygoid, one lateral to it, that is the masseter. So let's continue to scroll cranially. So the medial pterygoid is now moving medially towards the lateral pterygoid plate. So this is the lateral pterygoid plate, and the medial to it is the medial pterygoid muscle. This here is the lateral pterygoid muscle, and the masseter goes on to attach to the zygomatic arch. Now we will label the temporalis muscle and the lateral pterygoid. So I'm continuing to scroll cranially. So now here, this is the lateral pterygoid muscle. And as we saw, it extends between the lateral surface of lateral pterygoid plate and the temporomandibular joint. So this is the lateral pterygoid muscle. As we go cranially, we will start to see the temporalis muscle. So this sheet-like muscle here is the temporalis muscle. So these were the muscles of mastication. I would encourage residents to try and identify these muscles on planning CT scans of your own patients. Every patient, every scan is different. The only way you can get better at this is to practice this on as many patients as you can. Thank you.